Okay, so today I am going to be talking about rhinoplasty, which is a surgery that I absolutely love to do. I think it makes a huge difference for your face, and it really makes everything look much better. And actually, probably about 90% of people that are heavily photographed probably have had some form of rhinoplasty. So in order to have the best rhinoplasty possible, we have to understand the anatomy. So we're going to be going over that, and I have these handy little diagrams. So underneath the skin and soft tissue, we have a paired set of nasal bones, and then there are two paired sets of cartilages that are called the upper lateral cartilages and the lower lateral cartilages. Now, often people ask me, am I going to have to break your nose? And the answer is likely we're going to have to do something to the bone, because if your nose is crooked, if your nose is too wide, or if you have a bump on your nose, chances are we're going to have to do something to give you that nice, narrow, and beautiful dorsal line. Then we have to make changes to the upper lateral cartilages, often if there's a bump or any collapse or difficulty breathing. And then when we look at the lower lateral cartilages, that's going to really determine what the tip looks like, the position of the tip, how up or down it is, which is what we call rotation, and also how much it goes in and out, which is what we call projection. The other important structure to always remember that's in the nose is the nasal septum. Now, I'm sure we've all heard of deviated septums, and that the septum is the medical term for wall. It's the divider in between your nostrils, and it actually goes straight back. And this is important not only for breathing, but the septum also can affect tip position and projection. So when we make changes to those things, we always have to keep in mind the other structures that might be influenced by it. The other thing that's really important that isn't in this diagram is something called the STSE, or skin soft tissue envelope. And this is also going to really affect how things heal. So if your skin is a little thicker, it's going to take a little bit of a longer time to heal. And if your skin is thinner, then you might see results a little sooner. Now, you might think that thin skin is like the best thing to have ever, but it's also going to show any irregularity underneath the skin, and it also can have like contractile properties, kind of like those shrinky dinks, so it can warp and twist as it heals if you're not careful. So it's really important to understand this anatomy and to maintain a really strong skeletal support under the nose so that we maintain a beautiful and lasting result.